in just 2 years, the budget of Nigeria's Federal Ministry of Women Affairs has increased from 6.5 billion naira in 2024 to 154 billion naira in 2026. Now, this is significant. However, increased budgets only matter when they translate into real protection, prevention, and justice for women. So if 154 billion naira is truly to work for women, the Ministry of Women Affairs must prioritize the following based on evidence and in alignment with its mandate. 1. Gender-based violence prevention and response. Invictus Africa's 2025 Humanity Index reveals that 3 in 5 Nigerians have either experienced gender-based violence or know someone who has, with domestic violence affecting 51% of those who report. This shows that Nigeria's GBV challenge is not a lack of laws, but weak prevention, fragmented response systems, and limited survivor support. With expanded budget, the Ministry of Women Affairs should prioritize sustained investment in GBV prevention, which includes community programs, school-based education, engaging men and boys, multi-year social norm campaigns, and early warning systems that connect survivors to support services. Survivor-centered services that reduce out-of-pocket costs for medical, legal, and psychosocial care, and stronger coordination across institutions responsible for GBV prevention. 2. Women's health autonomy and protection. Evidence from the Nigeria Demographic and Health Survey, that's the NDHS, shows that many women are unable to make independent decisions about their reproductive health. Now, the Ministry of Women Affairs plays a critical role in addressing the social and structural barriers that limit women's autonomy. With increased funding, the ministry should invest in programs that address harmful gender norms that place the burden of family planning negotiations solely on women, engage men and community leaders to support shared responsibility in reproductive decision-making, and protect women from coercion, violence, or punishment linked to their reproductive choices. 3. Women and girls with disabilities. Women and girls with disabilities face higher risk of violence, exclusion, and neglect, yet they are often invisible in programming and budgets. Now, the Discrimination Against Persons with Disabilities Prohibition Act of 2018 mandates government institutions to ensure equal access to services, protection from exploitation and abuse, and inclusion in policies, programs, and public infrastructure. In line with this act, the Ministry of Women Affairs must ensure that increased funding translates into disability-inclusive GBV prevention and response services, including accessible reporting mechanisms and shelters. Programs designed to address the specific vulnerabilities of women and girls with disabilities, and data collection that is disaggregated by disability so no group is left behind. Finally, Invictus Africa's data shows that while allocations are rising, actual spending often lags. So we urge the Ministry of Women Affairs to prioritize timely budget release and effective spending alongside the policies and programs they support. With 154 billion naira on the table, Nigerian women deserve results.